I hope all you lovely people had a good snack. I'm still waiting for my Wegmans delivery. I hope they don't interrupt me in the middle of this, because I will totally ditch you all to go get those Cheetos. I'm so hungry right now. Wow. Anyway, are you ready to talk more about the constraint against harm? Gee whiz, me too. All right, good. So just to remind you, so far we've seen the nature of constraints, just what they mean, and why respecting individual persons might demand there be constraints on our actions, how we treat each other. And one seem obvious candidate, for what should absolutely be a constraint. If you like constraints, yes, you're almost certainly going to say there needs to be a constraint against harm. Now, we might ask ourselves, as I said, what exactly does this constraint against harm mean? That is, how is it constraining or limiting our actions? And now the usual way for understanding this constraint against harm begins by making a distinction between doing harm and allowing harm. So what is that difference? So doing harm is when the agent directly produces that harm. So doing harm is often thought about, active harm, doing active harm. Again, you're directly producing a harm in someone else. Now, allowing harm, that's just when the agent allows harm to happen, say by failing to prevent or eliminate the harm. So this is sometimes known as a passive harm. So yeah, the idea is that you're doing active harm, you're directly harming someone, or you could just be allowing harm, allowing passive harm to happen. You didn't cause it, but you're just not preventing it or getting in the way of it. Now, if you're a deontologist and you want a constraint against harm, which one of these is it? Is it against doing harm? Is it against allowing harm? Which one does the constraint apply to? Or maybe it applies to both equally. Well, let's go back to the chopping up Chuck example. Chop up Chuck. In this case, chopping up Chuck does active harm. Yeah, you chopped him up. You did it. You harmed him. You killed him. You chopped him up, doctor. Whereas if you do not chop up Chuck, you're just simply allowing passive harm to happen to those 5 other patients. Now, of course, most people look at this situation and say the right thing to do is, of course, not to chop up Chuck. So that seems to imply that the constraint applies to chopping Chuck. There is no constraint at all against not chopping him up. So the constraint again, putting that all together, then the constraint against harm seems to be against doing active harm. Again, the constraint is against doing active harm. Whereas when it comes to allowing passive harm to happen, that might be permissible. There's no constraint there, though. Now, of course, look, hey, allowing passive harm to happen can still be a bad thing because harm is still happening. But most people seem to think that doing harm is way worse than allowing it to happen. And it's so much more worse that doing harm needs to have that constraint. But again, if you go back to the example of rescuing the drowning child, we've seen that a few times now. I think we can all agree, I hope, that you should rescue the child. Rescue the child. Come on, don't be so selfish. You'll get dirty, but it's okay. A child will live. Yeah, most people say that you should rescue the child and not allow the child to drown. That is, you should not allow that passive harm of drowning to happen. Look, you're not drowning the kid. You're not sticking your hands, but you're allowing it to happen if you just stand there. Because the idea is you can avoid harm, period. And if you can avoid harm, full stop, then avoid all the harm. It's, avoiding harm is always the best option. But of course, you could be in situations like chopping up Chuck and in lots of the other situations we've seen where harm is going to happen one way or another. And in that situation, you should allow harm to happen. Don't do harm. So don't chop Chuck. Do not chop Chuck. There's a constraint there. But you can allow the passive harm of the 5 patients dying. That's sad, tragic, but permissible. So once again, the constraint against harm seems to say there's actually a constraint against doing harm. Now, if you like this distinction between doing and allowing harm, and you think that this works well, and you'd like to use that to, to have a constraint against doing harm, you have some tough questions you need to answer. Oh, I'm sorry. So the first tough question you have to do is explain the descriptive distinction here. Descriptive, just the facts, as we've seen earlier in this course. Yes, what is the descriptive distinction here? That is, how do we tell the difference factually, without your opinion, just factually, without any other kinds of judgment, just factually, how do we tell the difference between when an act is doing active harm versus when an act is allowing passive harm to happen? And that turns out to be actually pretty tough. Again, this is just descriptive. We're not even doing ethics anymore. I just want to know, what is the difference between doing a harm versus allowing a harm? And the example from medical ethics, so if you take the course on medical ethics, you'll talk about this, it turns out, because it's in the issue of euthanasia. I don't know if you guys are familiar with this issue, but euthanasia, just briefly, it could be understood as the mercy killing of a patient suffering from an incurable and painful disease. Very, very controversial topic, again, about doctors doing mercy killings for their patients who request it, I hope, from an incurable and painful disease. This raises some interesting questions. For instance, suppose a patient is on a feeding tube, feeding them because they're unconscious. If I remove the feeding tube from the patient, have I done an active harm, or have I just allowed a harm to happen? Because the doctor might say, I didn't kill the person, I just pulled the thing out. It's that they starved, once the feeding tube was removed, that's what killed them. I just allowed nature to take its course. Some people say, no, dude, you pulled that, you killed them, sorry. But you can see at least it's not as clean as we might like, but it can get even worse. What if the patient comes in unconscious on a stretcher, and they need a feeding tube in order to live, and I, as the doctor, refuse to even put the feeding tube in, and then they die because of that? Have I done harm? The doctor will say, I didn't do harm. I didn't do anything. I just stood there and said, all right, I let nature, So it seems there, maybe you now have just allowed harm to happen. But other people say, no, you could have done something. You should have stuck them with the feeding tube. It's doing harm. You didn't do So you see, it's getting trickier now. But now what even gets worse is, what if the patient themselves is on the feeding tube and they're conscious now, but they need the feeding tube for whatever reason? Suppose now the patient says, please, doctor, remove this feeding tube. And you say to the patient, that's going to kill you. And the patient says, I am fine with that. By now removing the tube, am I doing harm? Or am I just allowing, again, harm to happen? Because some people might say it's that, well, if they're asking you to do it, that really can't be doing harm. Can it? I don't know. Again, I'm not going to settle any of these. Take the course on medical ethics. It's a very popular course here at UB. You'll talk a lot about it, have some awesome discussions. I won't settle it. Tweet me. We can talk about it on Twitter for sure. But my point is simply that in practice, there are cases, and these are just descriptively. I don't know, is it doing or allowing harm? I haven't gotten to the ethics yet. I'm just trying to figure out, is this doing or allowing harm? Because if the constraint is going to apply to one of these, I have to know which one is it so I know if the constraint is working or not. That's just descriptive. But suppose you are able to resolve that descriptive distinction, and you can clearly classify harmful actions by, is this doing harm or is this allowing harm? Okay, good. And now the second challenge is, why is there a normative distinction? That is to say, why should doing active harm be forbidden by that constraint, whereas allowing passive harm may be permissible in certain cases? Again, the constraint only applies to the doing, not the allowing. Now, this normative distinction might just seem obvious. You might say, look, professor, if we can make that descriptive part work, then it's clear. Don't do harm. You may allow it under conditions, but don't do it. Now, I'll give you a philosophy famous example that does challenge this doing versus allowing. This is known as the drowning child conundrum. Oh, no, I got it wrong. The drowning... I would delete it, but I'm too tired. The drowning cousin conundrum. The drowning cousin conundrum. Actually, no one calls it that. I just made it up right now. But sounds cool, right? Sounds like a murder mystery, the drowning cousin conundrum. And indeed, this is a murder mystery of a sort. The situation is that you intend to kill your baby cousin by drowning her because you want a big inheritance. But the cousin, while your baby cousin is alive, you get nothing. They control the estate. But if your baby cousin were to die, under mysterious circumstances, you would get the full inheritance. So I'm supposing you want to kill your cousin. I'm sorry. Why are you always such a bad person? But here are the two scenarios. These are different scenarios, but I want you to think about the morality of each of these scenarios. So scenario one, you sneak in while your cousin's in the bathtub, and then you go and push your cousin underwater and drown them. This is a pretty clear case of doing active harm. Yeah, that's immoral and wrong. You did a very active harm. You drowned them so you could get your inheritance. Okay, that's scenario one. But now consider this other scenario, scenario two. Now here you sneak in, and as you come over to the tub, you notice your baby cousin has slipped into the tub, fell, and is unconscious under the water. You do nothing. You just stand there and watch with glee, I guess. I really think of you as making you sound really awful right now. I'm sorry. But you watch as your cousin drowns and dies. You don't even have to touch them. You just watch, and you get the inheritance because they died. Now, this is a pretty clear case of allowing passive harm. You didn't push them under. You came in and would have done it if you had needed to, but you didn't need to do anything. You just stood there. So you've allowed passive harm to happen. So scenario one, you did active harm. Bad. Second case, you allowed passive harm to happen. Now, look, here's something kind of, they're both bad. But here's the interesting thing, is that if you think doing versus allowing, that distinction matters, if you think that's an important normative distinction, then it is slightly, maybe more than slightly, but at least slightly better to just let your cousin drown. It's far worse to drown your cousin yourself, get your hands literally in the water there. But I think most of us right now are like, Professor, that's kind of crazy. I mean, both situations seem equally bad, because your cousin's dying so that you can, get the inheritance from them, because in both cases, you want your cousin to die. And it doesn't seem to matter whether you're just doing it or allowing it to happen. And so, it seems that doing versus allowing is not even a meaningful normative distinction. It sounds very nice, but it seems to start having problems, as the drowning cousin conundrum illustrates. But some people still aren't convinced by the drowning cousin. Maybe they try to figure that out. I'll let you think about that. But some people are still not convinced about that. They still think there's still a very meaningful distinction between doing versus allowing that has tremendous normative weight. And so I didn't want to do this, but now you're pushing me, you're resisting. You're like, no, Professor, I want this distinction. Okay, remember that. I don't want to do this. I really don't. But remember that first trolley example from way ago? That's the trolley example where almost everyone, maybe everyone in the class, wanted to pull that lever, kill the one person in order to save the lives of the other 5. So here, I'll put that decision up here in another table. Here it is. And by the way, might be worth noticing that table looks an awful lot like the chopping chuck scenario. Yeah, doesn't it look similar? But anyhow, back to the trolley table. There it is. Now let's just notice by looking at this table, by pulling the lever, you are doing active harm to that one person and killing them. You are dudes, you all pulled that lever. Dudes, you are doing active harm. Because look, if you don't pull the lever, if you refuse to pull the lever, you're only allowing passive harm to happen to those other 5. You didn't do it. The trolley did it. Oh my gosh. Now, I hope that blew some minds there, because when I first realized this, it blew my mind. I was like, crap, I thought this doing versus allowing mattered. But then I did it. Yeah, if you think there's a constraint against doing active harm, you cannot pull that lever. I'm sorry, everyone. I didn't want to do this, but it seems that you yourself, because almost all of you, again, if you abstained, well done. I guess you honored the constraint, but most of you violated a constraint against doing harm by pulling that lever. And so it seems you yourself don't think doing versus allowing has moral significance, because most of you were willing to do active harm and pull that lever. So Eureka, I know I mean, I love these things because when I was your age, when I was confronted with this, I was like, crap, I'm I'm really confused now. But to recap, when asked to specify the constraint against harm, most people, and like I said, I was that way too back in the day, most people think the constraint is against doing active harm, whereas allowing passive harm may be permissible in certain situations. But this then requires a very clear distinction between, a clear descriptive distinction between doing active harm versus allowing passive harm. We have to understand, what's the difference? How do I know it when I see it? And I noted that's kind of difficult with that example of euthanasia. And furthermore, if you can make that distinction, that descriptive distinction precise, then you have the challenge of showing there is also a normative distinction where doing harm is forbidden and allowing harm is maybe permissible. But then you have the drowning cousin conundrum, where it seems that doing and allowing are equally bad. There's no difference. Ultimately, they're morally bad, equally bad. And then finally, that first trolley example suggests that most of you watching this video seem to think it's okay to do harm in certain situations. So either you don't believe in constraints, maybe you're utilitarian, or you believe in constraints, but the constraint isn't against doing harm. There must be something else going on. And so putting that all together, we're just saying the distinction between doing versus allowing harm does seem pretty shaky. Indeed, a lot of people at this point do abandon it as just not working. It seems to have too many problems, especially if you want to make sense of a constraint against doing harm. So perhaps we need a different distinction, one that better helps us understand this constraint against harm. But before I dive into that last little bit there, let's take that one last quick break. Maybe my Cheetos are here. God, I'm really craving them now. Gosh. Okay, let's take that break and I'll see you back here in a few minutes.